guys go rushing. 2 guys are down. We're going to evaluate. This one, he is talking, he is coherent, he got some shrapnel in the leg, not too bad. As you can tell here, a massive chest wound. He's ripping with the scissors, he's looking at it. Again, evaluate, stop the bleeding, and then stop the pain. In that case, he's ready. There were 32 medics in a battalion, and part of that team were a litter team. So we would yell for litter team. Litter, up and forward. Litter. Watch his leg, watch his leg. Litter bearers are supported.
Ready?
Go.
3, 2, 1, go.
Going on chaos.
Lift it,
A
lift
lot of
it.
times,
Good.
GIs that drag your head down, they're shooting at us. You gotta actually make some tough choices as whether to say, let him go, he'll be all right, or get him back.
Hey, up here. I mean, get back
So the
there.
first guy's gonna go, litter team's gonna pick him up.
Ready?
1, 2, 3.
Go, 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 go.
They're coming back. He could have been on a Jeep. You're gonna bring him back. Back, we have a leg wound coming in. Leg wound coming in. Up. Keep going right there. Now, if you wanted to start coming this way, we'll get that guy in a second. Just come this way, and the doctor's going to assess what's going on. Go ahead, Doc. He's looking at the tag. He was already wrapped for a shrapnel wound to the leg. Anything, what do you want to say?
The obstacle course.
All right. So a lot of times, up, forward. Now you can imagine the chaos. It's just chaos for 2 drivers. Imagine multiple casualties coming in. They're assessing. Now the doc, you say, Doc, we have a wound over here. He would come over and say, oh no, he's serious.
This is true.
We're gonna get him right to OR. Don't waste your time. We'll get his pressure in. Litter team, back to OR. Team back. Good. Okay. At this point, all they did was move a piece of shrapnel from the man's leg, so he's gonna be okay. But if you come over, we're gonna talk you through the surgery right here.
Ready?
Yep.
3, 2, 1, let. Come out to the side.
You'll be okay,
Come
soldier.
straight this way. There you go. Straight through. Straight through. Come this way. You guys go that way. Pick up, get them on here.
Back we got a chest wound, try to stop the bleeding. Once they're at a morphine, blood pressure very low, rapid heart rate. Nurses, stop.
Wash your hands if you haven't done it already. Keep your gloves on. Or for, not sterility, but for protection anymore. But it is sterility issue. There'd be somebody checking his vital signs. I would get down here to the chest wound. I've already looked at the card, saw what's going on. You can take a look. For those of you that can see that close, we have fake chest wounds. So basically he's got exposed ribs blown out, the whole bit. We make this just a little bit bigger. In real life, if you had time, you would cut it off. You put drapes on as best as you can for sterility. Please remember you already have a highly contaminated wound, so there's minimal that you can do. In real life, I'd cover his head and face too.
We do E3F.
We did not.
Okay.
So if anesthesia is available, get them over here.
Do you have anyone from anesthesia available?
Yep. Absolutely, sir.
You got someone from anesthesia?
For the most part, ether. That's all we had. All right, so anesthesia would take, in some case, oh, he's coming. If not, I'll say you do double duty.
I'm here for double duty.
One gentleman or nurse would get the IV started. Everyone helped everybody else out. Nobody did anything was nothing.
Just a fun fact. While the current aid station is here and they're doing up, there could be firing going on. There was times when howitzers would be going and the earth would shake, tents would shake, dust would drop down while they're actually operating.
I'm going to cover your
In
eyes.
fact, I read sometimes surgeons would dig like 2-foot hole where they would stand in the hole. That way, when the percussion, it would shake as much.
Now, in World War II, the blades were already on. Here, we just have separate blades that we put on. I'm not going to do it just for the sake of safety. So I would get in. I'm going to need hemostat. And I need that kidney pan. So I'd get into the area. I'd make it open a little bit better. If this was a penetrating chest wound, I'd end up having to put in a chest tube as well. Stop the bleeding as quickly as I can. I go in, I grab what I'm looking for, pull out a projectile, get rid of it. Not uncommon. We're getting hit with automatic fire, multiple projectiles. You get them out, you get rid of that, you get some suture material, and you just close it up real fast. Your chest tube has to go in separate, so I'd have to make a separate hole on the side. What you're trying to do at that point is expanding the lung. Depending on how severe the damage is, a lot of times you have to get in there and repair the lung or actually remove that part of the lung. The right side has 3 sections, the left side has 2 sections, so we can always remove a section if we needed to. You close it up real fast.
Can we explain about the ether and exactly what he's doing and how we do that? With the
We're
anesthesia?
applying anesthesia, doing an open drop of diethyl ether. 90% of the casualties used to come through here. This is our procedure. It's a little bit better than chloroform. Bring me that man back.
Typically, we would have either blood or plasma running, depending on the severity of the wound and estimated blood loss.
How did they determine their blood type? Was it on their dog tag?
It's on their dog tag. My dog tag, I know I'm A positive. Typically, though, it didn't make a difference. All blood was O negative. Plasma didn't make a difference. You then take your drapes off. If not the same dressing, you get a new one. You wrap it back around. You tie it off. They pick him up. He stops the anesthesia and goes to the next station. Now, obviously, that surgery would have taken longer than this. If you see MASH, you know what they're doing. There's a difference between aid station, hospital, which is real quick right at the front, and then moving on to recovery. We're trying to stop bleeding, not fix the underlying problem. Okay?
If he has to go to a further field hospital, if his wounds are that severe.
The weapons that they used, the full metal jackets, was that a benefit or a hazard to the...
Technically, the metal jackets are supposed to be full metal jackets because you didn't want your enemy to die of lead poisoning. We don't care if we shoot a deer now and they die of lead poisoning later. But either way, they still would fragment, they would still mushroom. The idea with modern weapons is the bullets tumble and yaw, and that way they cause more damage. So once they hit, especially if they hit a bone or something, now you're trying to pull out all the little fragments. At this point, you would never worry about how many fragments. They'll get a chest x-ray, they'll see exactly what's going on. People still walking around with bullet fragments in them. Believe it or not, the heat of that gun being fired and the velocity actually sterilizes that bullet in most cases. The infections happen from all the material and everything else that, you know, when you get hit, that go into your body.
That wound that you were working on, I know it's a fictitious wound, but it would have assumably entered from his back?
Yes, you still have to work on the back side too. It's little hole in, big hole out. And depending what it hit in the middle, there may be multiple holes coming out. If you guys recall Ronald Reagan, those of you that are old enough, when he got shot, he was shot in the axilla. He was waving. I don't remember which hand. I think it was this hand. He was shot here. Okay? The bullet went in, struck a rib, and went down. So it actually entered his abdominal cavity. That's why he almost died from blood loss.
Yeah.
They didn't even know he was shot originally. So. And then the stretcher bearers would pick the guy up and move to the next. I love the answer to your question, and I'm going to show you in a few seconds. Bone saw. He would typically need a lot heavier anesthesia than he's had. What you do is you tie off the artery, you tie off the vein, and you cut the bone off. You leave enough tissue to flap it up, and that's just to close it temporarily. They're going to have to do a revision later. At this point, the main job is saving the life,
It's finished. Okay.
controlling the bleeding.
How was that the thing whether or not you stopped the major flow of blood?
How do you know you stopped it? Visually. Also, his blood pressure should improve. Heart rate should eventually go down because it's going to be fast because of the bleed, you know, the injury, the bleeding, the massive adrenaline rush to the body. Yeah, we would get blood pressure and all that.
He would have a blood pressure.
It's not like modern. Now you got every wire you can put on the person everywhere, and you're watching what's going on. Back then, you know, GI stood for government issue.
Those are people who have
Government issues sometimes got
opportunity of getting
thrown
a ride
away.
in World War II aircraft.
Look around. We do have a
If you ever have
recovery
the
area. They're
opportunity
taking
to
the
do so,
nurses are
believe
taking
me,
care
it's
here.
definitely worth it. It is present so
If you look
No
around,
problem,
the
guys.
IVs we put on, doing the
You guys got to pick him up and take him
So
somewhere.
thank you for coming and hopefully
always
get some idea of
what it felt like
the medics
to
doing.
ride in the
MKs, we need another stretcher bearer. Thank you.
portion of our program today here at World War II weekend. Forward. In the meantime, we're going to give you a real quick thing.
You call it. You call it.
If you're not doing the degrees and
Pull them out this way.
today,
Stop. Turn.
make sure you stay hydrated. Okay? It might feel like it's not too bad right now, but that
Up. Good. Watch out. Make sure that he's on. Is he on? Yep. Good. All right. You doing all right? Glad you're okay.